Hello, this is Bruce McCullum with Direct Care Training and Resource Center. And today what our focus is the issue of evolvement and the necessity of looking at our business model as a partner to others if in fact we really want to be successful based upon the ingredients that are in the environment today. You know, back in 1995 when I started in adult daycare, things were really different. And as I reflect back on those days, it reminds me that everything really does evolve. I mean, think for a minute about 1976, 1977, and some of those Chrysler station wagons with the wood panel on the side, and depending upon where you lived, eventually it faded pretty badly and you had a rather unattractive vehicle. Well, those things don't work today. Now think about methodology when it comes to advertising and how it relates to the automobile and how it relates to even hospitals who are competing heavily against one another. Think about 30 years ago when you never saw a television commercial for a pharmaceutical. And of course, the pharmaceutical industry pretty much marketed their products to physician groups and hospitals and clinics. And today, ask your doctor about Lipitor. It's all over the television, the radio, and of course, billboards. Well, adult daycare has evolved as well. When I got started, we really were focused on providing supervision for that person who was demented, who just could not stay home alone all day while the daughter or the son went to work, or and needed to go to the adult daycare program to receive personal care in our shower, or to give that stressed spouse a much needed break. Well, today those same ingredients are involved in the adult daycare program that we're seeing in 2013, but there's so much more. And it has to affect the perspective of the operator. For example, we need to see ourselves in adult daycare as real partners of hospital corporations. Did you know on average the markup, or should I say profit, in the nonprofit organization they may say funding remaining, is only about 2% annually? And that increases significantly in places like Michigan where they can build the auto no-fault system depending upon why the person was admitted. But that's about it. The margins are pretty thin. So when you talk about being penalized because somebody is back in the hospital with the same or a very similar clinical diagnosis less than 30 days after their last discharge, a hospital gets real concerned. And that's where an adult daycare has to understand the need to position what you do as a clinical model program as a partner to that hospital corporation. And your role in that hospital, even if you were to view yourself as another department of theirs or somehow a community extension, you need to assist them in helping people to remain in the community. You do that with good medication administration. You do that with good nutritional management. You do that with good rehabilitative therapies. You do that with a program of supervision. You do that with a program of counseling, family education, and intervention to help persons manage the onslaught of geriatric depression and more, which leads to the kind of neglect that sends a person back to the hospital. If, in fact, we view ourselves in the adult day services arena as real partners to the hospital community, we win. Please pay attention to upcoming events and special events at www.directcaretraining.com, www.americancarenews.com. Attend webinars and conference calls that provide you with the ingredients to make sure your program arrives at that next level. If in fact you're not evolving, if in fact you're not viewing yourself as a partner, it may very well be that as the American healthcare system moves forward, it's a chariot you'll end up being left behind by. The question is that what you're after? Or do you define success by keeping up with where your business model is headed?